My name is Kathleen. I live here in D.C. and I'm at the protest today because this bill would be a horrible step backwards for people's health care. I am a 9-year cancer survivor. I was diagnosed before the Affordable Care Act, and even though I bought a $1 million policy, my insurance company only covered $100,000 per condition. So they cut my coverage off midway through chemo. And there are other exclusions. They didn't cover prescription drugs, and I was only 26 years old, so if Obamacare had been in place, I could have stayed on my parents' insurance. So it protects people like me with pre-existing conditions, people on Medicaid, the elderly, disabled, and so it's so important to keep it protected. Mr. President, this bill is not what you've been sold. This is just a tax cut. It's not a health care bill. It's a tax cut for the wealthy, and it pays for that by taking care away from a lot of poor and middle-class people. You said that premiums and deductibles are too high, and this bill would make them go higher. This is the wrong way forward. We need to defeat this bill and then work together to improve the health care we have. I'm the face of the injustice of the system before the Affordable Care Act, where your care could be cut off, where you could be denied for having a pre-existing condition. And it's very real to me. I'm pregnant right now. Maternity care is another pre-existing condition. So this bill is not the way forward. Please vote it down so we can work together to improve health care.
All of those people and many people with disabilities rely on Medicaid. Medicaid often allows people to go to work. Some of us may need someone to come into our home, help us get ready so that we can go to work, so that we can make an income, so that we can pay our taxes, so that we can get to the voting box, so that we can be a part of our community. Mr. Trump, you say your jobs, jobs, jobs. The Medicaid programs, particularly with people with intellectual and developmental disabilities, support them in just that. Working, being a part of their community, if only volunteering, finding ways to be included. That's what it takes to support people in getting there. Don't cap, don't cut our care. I want to be a fully inclusive citizen of the United States, and the programs and services that Medicaid provides people with disabilities makes that happen.